PT to the Gym, episode 4. I'm Pat with Suarez Physical Therapy.
This is Mike from Capital District Sport and Fitness.
And we're here at Capital District Sport and Fitness, and today we're going to talk about knee pain, but specifically knee pain at the front of the knee, kind of just below that kneecap area that you might feel when you're squatting deep or you're starting to run or jump or anything like that.
And then after that, we're going to talk about how you can, while you're in physical therapy, modify some of your lower body exercises in the gym to take some of that stress off the knee, still be able to train your lower body muscles, but while allowing your rehab to progress and stay pain-free.
All right, so let's take a look at what we have going from PT to the gym. All right, so here we are. We're going to talk about the first thing I like to do when I have someone who's got that anterior knee pain just below that kneecap, right? So Dan's got a band around the knees, just above the knees, and we're going to work a little bit of a squat, but we're going to do an isometric. So he's going to hold his squats. Now we have different levels we can do this at. So Dan, you're going to start off at that 30-degree level. So about 30 degrees, you notice he puts his hands out in front. That lets him get his hips back, keeps his knees back. He's pushing out on that band and he's holding that position, right? And so this is a low load position. This is an easier position. So if he goes down to 60 degrees, that's going to put a little more stress through those knees, a little more difficult. And then he's going to go down to 90 degrees. And that's going to be the most difficult in this standing position. Now, come on up, Dan. Nicely done. Now, come on over here. If all of those are painful, then what we can do is get you up against the wall. His back's up against the wall. That's going to allow him to sit back further, and he's going to go through all of those angles again. What we want to do is find an angle that produces no pain, but we're still putting load through his knee. So what we found with tendons now is that we want to produce some kind of tension, some kind of load through that tendon to help that tendon heal. We don't really want to rest it. So if Dan is comfortable against the wall at 90 degrees, I'll have him push out on that band and I'll have him hold that there. Again, we want to create some kind of load, some kind of tension through that knee to start repairing that tendon. All right, here we are. We're going to progress those exercises a little bit to put a little more load through the knee. So here we've got the TRX, and what Dan's going to do, he's going to get into this lunge position. He's going to use his arms as much as he needs them. He's going to have this slight lean back, as you'll see. And what he's going to do is he's going to bring that back foot off the ground slightly, and he's going to do a little bit of a squat with that left leg. Now, go ahead and rest right there. So you notice that Dan's sitting back into his hip, right? So that's going to keep his knee back for right now. It's going to load up his knee, but it's going to take some of that pressure off. So we're still loading it more than what we were doing with the band, but we're not fully loading it and getting his knee over his toe just yet. And then come on back up. Good, and then he's pushing back up through there. So it's nice and slow and controlled on the way down, and then he's pushing back up. So this is a progression of what we would do as you got better and we were able to load you more through that knee to get you ready for getting back in the gym and lifting with a squat or with a lunge.
This is Mike and Pat back at Capital District Sport and Fitness. And Pat just talked a little bit about what you should do when you have patellar tendon issues and some trouble with the front of your knee and some good rehab exercises you should do. And today we're going to talk about your squat in the gym, and mainly we're going to talk about the high bar squat versus the low bar squat and how that impacts your knee and your hip position. So first, Pat's going to set up in that high bar position. Now when the bar is higher on your back, you're going to have more of a vertical torso while you're squatting, which means you're going to have a little bit more of a forward translation of your knee, which is okay and fair game, but when you're having some issues with that patellar tendon, that movement and with the load on your squat just may be a little bit too much for the time being and may exacerbate some of your symptoms. So Pat's going to re-rack it right now, and we're going to adjust to a low bar squat. So when we get that bar a little bit lower on your traps and we unrack it, it's now going to set us up to have the movement be a little bit more hip dominant. And Pat needs to be aware and conscious of pushing his butt back a little bit to initiate the movement and then pulling his butt down to the box. And you can see now when he's going through this movement, let's hit another rep right here, Pat, that when he's pushing his butt back and then pulling down with the low bar position, he has a little bit more of a vertical angle from that knee down to his heel. When we have more of that vertical angle, there's going to be less stress and load through the patellar tendon and more load through the glutes and hamstrings. And just be aware, you may have to pull some weight off the bar from what you're used to doing if you are a high bar squatter, and kind of groove this movement and see if it feels better for your knee and if you can feel more of the glutes and hamstrings working. This is Mike and Pat back at Capital District Sport and Fitness, and we just went over how you can modify your squat to alleviate some knee pain. And sometimes even with that modification, the amount of knee flexion and load that you have during the movement just may be too much for you. So now we're going to talk about how you can still get a lower body training effect without doing a squat. So right now we're going to talk about two different exercises, and the first one is the trap bar deadlift. So Pat's going to get set up in it, and you'll see this is a great exercise to load the glutes and hamstrings, but a common error you'll see is setting up with the knees actually pushing forward too much and turning this, what should be a hip dominant exercise, into a more knee dominant one. So when we see that, we're going to think about pushing your butt or your belt line back towards a wall behind you. And you see now Pat is more vertical with this straight line knee down to his heels. And Pat, in this position, do you feel your hamstrings building up good tension and work?
Tight through the backside, yep.
Perfect. Once we feel that, you want to push your heels down through the floor and use that tension that you just built up. So Pat's going to push through the heels and stand and control back down. And we want to make sure when you get to the bottom that you finish in that exact same position with the knee to the heels. So your big thing is thinking about pushing your butt back towards the wall behind you when you lower. Verse, Pat's going to show you now when you push and stand. So get set up in a good position. Stand up using the hamstrings by lowering, pushing the knees forward too much. So instead of having that, which is loading the knee more, you want to make sure when you're lowering down with the movement that you're pushing your butt back towards the wall behind you so you finish in that same position. And we can rest right here. Now, not everybody's going to have a trap bar available to them, so we're going to also show an RDL, or Romanian deadlift, with the straight bar. So the same concept. On this, we want to set up, so we'll unwrap the bar, Pat, and keep that bar nice and close to you the whole time. We want to set up with a soft knee bend, and you want to maintain that same knee bend during the whole movement. So your only thought is your butt or your belt line pushing back behind you, that bar sliding down your body. So Pat, if we hold there, you feel that same build in the hamstrings, and now we're pushing the heels and squeezing your butt forward. So same thing, butt back, eyes follow that bar, feel the work in the hamstrings, push through the heels and stand. So we can rack that right there, Pat. So if you're having knee pain, the squat is too difficult for you right now in regards to your knee, give the trap bar deadlift and RDL a try, and just be aware of making sure the movement's coming from the hips and not the knees.
All right, so another piece that we need to consider when we're talking about that anterior knee pain is the stability of the hip. So we need to make sure that we're strong, we're able to control that hip so that knee isn't taking too much load, too much tension. So one that I like to do is called a hip airplane. So Dan's gonna go into his single leg deadlift about 30 degrees, arms are gonna go out to the side, good, and he's gonna rotate to open up that hip, good, and then he's gonna rotate to close it down. And you'll notice he's wobbling a little bit, and that's normal. We want it to be challenging. But in order to control that, in order to take some of the load off the knee, we've got to be able to control that hip. So that hip needs to rotate, it needs to flex, and Dan's kind of being put in all those positions as he's doing this airplane. So this is one that I like to include to help take some of that compression and that load off the knee. And then as we get back to our sport or our lifting, that hip is ready to take on more of that load.
Hey guys, this is Dan with Capital District Sport and Fitness and Pat from Suarez Physical Therapy. And we're going to add on to some of the stuff we talked about already when it comes to your shin angle and lower body exercises. And now, just because you have some type of knee pain and that anterior knee pain doesn't mean you have to also stray away from single leg exercises. But we have to be conscious of that shin angle that we talked about in the squat and in the deadlift. So Pat's going to go ahead and get set up into a split squat position. So he's going to go all the way down to the bottom. He's going to start with his knee on the pad, and we're going to take time to look at the shin angle here before we do any type of movement. So starting off, we're going to have a nice neutral shin angle here. Straight up and down. He's 90 degrees from his knee to his heel and his knee to his hip in the front and also in the back. So from here, Pat can stand up, drive through the heel, all the way up, control and pull himself down through the pad. Now as we progress through your rehab, we want to be able to put a little bit of load into that patellar tendon and create a little more resiliency in that knee. So what we can do is create a more positive shin angle through that split squat. So what Pat's going to do here, he's going to pull his foot a little closer to his midline of his body, and then he's going to, again, create that more positive shin angle. He's going to drive up and then control back down through the pad. Good. And as you progress through your rehab and get more comfortable with that positive shin angle, it's important to continue to train that for things like cutting and moving around the field, whether you're playing football or on a court playing basketball or even baseball. We have to be able to get into those positive shin angle positions comfortably.
All right, so that was PT to the Gym episode 4, talking about anterior knee pain. And I think one of the big takeaways, Mike and Dan, is that you really, from whether you're doing your banded squat or you're doing your back squat, take into account that shin position. Starting off with a more neutral position to try and build tolerance in that tendon, and then moving more towards that positive angle of that shin.
Yeah, I think it's the same with a lot of other tissue injuries that we see is you don't have to necessarily shut down your training, nor should you. You should be more conscious of the positioning of your body and your setup and your technique and how you can alter those things to take load off of the tissue that's injured and be able to train other tissues that probably need strengthening, and then gradually kind of reintroduce this load to that injured tissue so one day you can get back to doing the things you want.
And I think that's a great point. What we're finding more of is that rest is not necessarily the answer, but that gradual load to that tissue to help build, like Dan was saying, to help build that resiliency of that tendon back up so you can get back on the field, do your jumping, your cutting, back on the court, what have you, and do all of that stuff without having that anterior knee pain. So thanks for watching. There are more episodes to come. If you like it, go ahead, subscribe, check us out on Instagram, and we'll get back to you next time.